Hello, today we will see about the management of acute ST elevation MI. Particularly, we will see about the role of dual antiplatelet therapy in the management. There are various aspects of this lecture which we will cover. So, for that purpose, we will start with dual antiplatelet therapy. We will start the antiplatelet therapy as soon as the possible after the diagnosis of ST elevation MI, whether it be in ambulance or in hospital. The goal of this therapy is to restore the perfusion to the cardiac muscle, due to which there is ischemia due to the clot blockage in the coronary vessels. And secondly, we have to prevent the clot progression so that the damage could be minimized. Now, the choice of the drug is either aspirin or a P2Y12 inhibitor. Aspirin is given to all patients of ST elevation MI after considering the risk and benefits. The loading dose of aspirin is 165 to 325 milligram in chewed or crushed form. It is given within 24 hours ASAP. The maintenance dose is 75 milligram daily. Second is P2Y12 inhibitor, which include two drugs, either clopidogrel or ticagrelor or prasugrel. Now, these two drugs are varied upon their risk benefits ratio. Clopidogrel is given in the case of PCI and in the case of fibrinolysis, and ticagrelor and prasugrel is given in the case of PCI. The choice of these drugs depends upon the reperfusion strategy we are using in the patient. Now, there are two types of reperfusion we do in MI. Either we do PCI if time is and resources are available, or we fibrinolyze the patient. For PCI, we give ticagrelor and prasugrel. These two drugs are used when we plan to give PCI to the patient. The loading dose of ticagrelor is 180 milligrams, and for prasugrel it is 60 milligrams. In fibrinolysis, the choice of the drug is clopidogrel, and the dose of clopidogrel, it depends upon the age of the patient. If the age of the patient is greater than 75 years of age, we will give the loading dose of 75 milligrams. But if the age of the patient is less than 75, the loading dose will be 300 milligrams. For the maintenance dose of ticagrelor and prasugrel, we will give a maintenance dose of 90 milligrams twice a day in ticagrelor, and in the case of prasugrel, the maintenance dose will be 10 milligrams OD. Now, the next question is for how long the dual antiplatelet therapy should be given following in a case of acute ST elevation MI. Now, according to the research guidelines, it should be given at least 1 year following MI, and after 1 year, the risk and benefits should be analyzed, and it can be continued later on for at least 36 months. There is no harm in extending the dual antiplatelet therapy.